All right, we're going to look at chapter 13, the male reproductive system. We'll look at some of the functions and terms that we use. The functions of the male reproductive system is to produce and maintain sperm, introduce sperm into the female reproductive tract to fertilize the female ovum, and secrete certain hormones necessary for the maintenance of secondary sexual characteristics in the male. So the organs or parts of the male reproductive system that we see would be the penis, erectile tissue covered with skin. It contains urethra for urination, ducts for secretion of seminal fluid, which is the semen, which is mixture of secretions of the testes, seminal vesicles, prostate, and bulbourethral glands, discharged from the male urethra during orgasm. Glans penis, bulging structure at the distal end of the penis, and the pubis, which is the foreskin, a loose casing covering the glans penis, typically removed by circumcision. The scrotum is a bag, skin-covered pouch in the groin that's divided into two sacs, each containing a testes and an epididymis. The testes or testicle is for one of two male reproductive glands located in the scrotum, produces sperm and testosterone. Sperm or spermatozoon is the male gamete or sex cell produced in the testes, unites with the oomen, the female, to produce offspring or a baby, is what the goal is. Epididymis is the coiled duct at the top and at the side of the testes that stores sperm until it's released. The vas deferens is a duct that carries sperm from the epididymis to the ejaculatory duct. The seminal vesicle is one of two sacs connected to the vas deferens, secretes alkaline substance into the semen to enable the sperm to live longer, so it helps them survive. And the ejaculatory duct is formed by the union of the vas deferens with the duct of the seminal vesicle, and fluid is carried into the urethra. So here gives you a little picture, cross-section picture. There's a frontal view as well, and then typical sperm and what it looks like. The prostate is a triobular gland that encircles the urethra. It's located just below the bladder, and it secretes an alkaline fluid into the semen. So if you look there, we're going to talk about some issues that we have of where it's located. Hypertrophic or hypertrophy is going to be where you see over here on the left, a normal bladder, prostate, urethra. And then the one on the right, you could see the pressure that it's putting on there. It's narrowing, it's enlarged, compresses the urethra, and then will make it difficult to urinate at times. Ballino means glans penis, so ballinoplasty would be referring to having repair. Epididymitis would be inflammation. Orcho, orchio, orchito, and testo are all referring to the testicles. So, which makes it difficult at times because there's many terms for one thing. Perineo is the perineum or the perineal area, so that's gonna be between the rectum and then the penis and the skin underneath there. And then that we also use that term with female would be between the vulva and the anus in the female. Prostate, prostodynia would be pain of the prostate. Spermato and spermo are both sperm, which means seed, and vessel, vasorrhaphy, suture of a vessel. Symptomatic terms, spermia, so A meaning none, so inability to secrete or ejaculate sperm. Azoospermia, which would be semen without living spermatozoa, a sign of infertility, zoo meaning life. Oligospermia, which would be decreased production. Mucopurulent discharge would be drainage of mucus and pus. Anorchism is absence or one or both testicles. Balanitis, inflammation of the glans penis. Cryptorchism or cryptorchidism is where you have undescended testicles, so they didn't descend all the way, sometimes at birth. So failure of it to come down into the scrotal sac. Crypto is to hide. So cryptorchid is often used to say that too, and sometimes you can do surgery to fix that. Epididymitis, inflammation of the epididymis. Erectile dysfunction is the inability or failure to maintain an erection. And then there's medications for that depending on the cause. Hydrocele is hernia of fluid in the testes or in the tubes leading from the testes. Hypospadias is the congenital abnormal opening of the male urethra. So usually at the tip, it's on the undersurface of the penis. And then Peyronie disease is a disorder characterized by a buildup of hardened fibrous tissue in the corpus cavernosum, causing pain and defective curvature of the penis, and it usually happens during erection. Phimosis is a narrowing condition of the pubis foreskin, resulting in its inability to be drawn over the glans penis, often leading to infection and requiring circumcision. BPH is benign prostatic hyperplasia or benign prostatic hypertrophy, enlargement of the prostate, often seen in older men. Prostate cancer is malignancy of the prostate gland. Prostatitis, inflammation of. Spermatocele is painless, benign cystic mass containing sperm lying above or posterior to the testes. Seminoma is the most common type of testicular tumor composed of immature germ cells, highly detectable and early treatment. Non-seminoma is tumor arising from mature germ cells. They tend to be more aggressive than the seminomas and seen earlier in life. Varicocele is an enlarged, swollen, herniated vein near the testes. So varico meaning twisted vein. Testes and appendages. So you'll see here where you have a hydrocele, spermatocele, and then a varicocele. So you can see it's all around the testicles there, and it can be very painful. Cryptorchid patient or cryptorchism. You can see the different levels of where the testy can be before it descends. Hypospadias, so the shaft of the penis, the urethra, again, doesn't, it's not on the tip. There's a balanic hypospadias and a penile hypospadias. So at the very, on the picture on the right, the person urinates, it's under there. So guys, don't make fun of guys if they have to sit down to urinate, because if they stand at a urinal, then it usually gets urine on their pants. Peyronie disease, you can see the curvature of the penis, and it usually is painful and happens during erection. Phimosis, would be the skin, the foreskin's not being able to draw back over and ends up having a lot of infections, and they need to be circumcised. Some sexually transmitted diseases, or STIs now we call them, sexually transmitted infections. So it depends on what book you're reading. Chlamydia, most common transmitted bacterial infection in North America, often occurs with no symptoms and is treated only after it's spread. So it's what we call asymptomatic, not a lot of symptoms. Gonorrhea is contagious inflammation of the genital mucosa membranes caused by the Gonococcus neisseria bacteria, and then it has a urethral discharge. And so usually that person is symptomatic, and all these obviously can be spread. Syphilis, which is a major increase right now in San Joaquin County, is caused by the spirochete, which may involve any organ or tissue over time, and it manifests first on the skin with the appearance of a small painless red papules that erode and form bloodless ulcers called cankers, and also will end up being on the body as well. And you could have neurosyphilis, which goes to the brain, makes people confused and kills them, so it can be pretty bad. HPV is hepatitis B virus, which we also have HPC, hepatitis C virus, but it's a virus that causes inflammation of the liver. Herpes simplex type 2 is viruses that cause ulcer-like lesions of the genital and anorectal skin and mucosa. After initial infection, it lays dormant in the nerve root and may occur at times of stress. HIV, human immunodeficiency virus, causes the AIDS virus, contracted through blood and body fluids. HPV is a human papillo virus transmitted by direct sexual contact that causes infection that can occur on the skin or mucous membrane of the genitals, and is also said to be a precursor to several types of cancer. Condyloma acuminatum is lesions that appear as a result of the human papillovirus on the skin. They appear as cauliflower-like warts on the mucous membrane, and they have a flat appearance, also known as mineral or genital warts. Here's a syphilitic canker. Looks very painful. Some tests that we do, biopsy, obviously, if the person's having a prostate problem, we get a piece of tissue and send it off to make sure it's not cancer. Same with testicular biopsy. If somebody has a lesion or a tumor on their testicle, we're going to biopsy it. A digital rectal exam is insertion of a finger into the male rectum to palpate the rectum and feel the prostate. A prostate-specific antigen is a blood test that we use to screen for prostate cancer. It's elevated in the presence of cancer cells. Erythrogram, X-ray of the urethra and prostate. When we analyze the semen, it's a study of the semen to look at it for the count, the form of it, the motility, usually if somebody's infertile. Endorectal, transrectal, sonogram of the prostate, scan of the prostate after introducing an electronic transducer into the rectum to guide a needle biopsy. So this is what we often use in conjunction. So this is how they do that. So they use the ultrasonic probe, and then they put a little needle in there and then take out a piece of tissue for the biopsy. Operative terms, circumcision. This is going to be where we're going to remove the foreskin or the pubis to expose that glans pubis. Epididymectomy would be removal of the epididymis. Orchectomy or otomy would be to remove a testicle, often in the presence of cancer. Orchioplasty is what we do, repair of a testicle. We often do that if we do orchiectomy to remove a testicle, we could put a fake one in, so at least it's symmetrical. Orchiopexy would be fixation of an undescended testicle in the scrotum, so we're bringing it down. Prostatomy or prostectomy would be removal of the prostate gland, and we can do that with a transurethral resection of the prostate, TURP. So we actually go through the urethra using a rectoscope and a urological scope, and then we go in there and kind of cut up and suck out the prostate. Vasectomy would be to remove a segment of the vas deferens to produce sterility in the male, and a vasovasotomy is restoration of the function of the vas deferens to regain fertility after a vasectomy. Change your mind. Here's the TURP. So they're going to go in there and they're going to, let's say, slice up that prostate, and then we'll put in a Foley catheter, and with the urine comes out, there'll be tissue in there and chunks, and it's very bloody at first, so we're irrigating it to make sure everything comes out. Here's a vasectomy. You see the vas deferens and how they're going to go in there and what we call snip it. You can see there, they're going to withdraw the incision, a section is removed, and then they tie it off. Some terms that we used for therapy. Chemotherapy is used for malignancies, infection, and other diseases, and radiation therapy, same thing. Although we do see a little bit more like internal implants of like in the prostate seeds. So radioactive isotopes that could be injected through the urethra, and then they could sit in the prostate and kill the cancer cells. Hormone replacement therapy to increase if somebody has a deficiency or needs to regulate. So we give a lot of testosterone for men. Penile prosthetic would be, or prosthesis, implantation of a device designed to provide an erection of the penis. So you could put one in that has like a button, and then they pump it up, and they can deflate it when they're using it or not using it. And then a penile self-injection is an intracavernosal injection therapy causing an erection using the treatment of erectile dysfunction. And that is it for chapter 13.